Hi, everyone. Welcome back. So right now, our next speaker is Kent MacLeod, a clinical pharmacist, and this topic is low-dose naltrexone in the gut microbiome. So Kent MacLeod is a pharmacist as well as the founder and CEO of NutriChem Compounding Pharmacy and Clinic in Ottawa, Ontario. He is an international thought leader and award-winning pharmacist with over 40 years of clinical experience delivering patient-centered healthcare. He is globally recognized as a hormone health and nutrition expert, has lectured at many health conferences, published research, and developed course materials for many professionals' clinics based on NutriChem's success. He is the author of the book Biology of the Brain: How Your Gut Microbiome Affects Your Brain, and his focus is on the relationship of the gut microbiome to mental health and immune function. So welcome, Ken. Thank you so much for being here today.
Thank you for having me, Emma.
So you were really passionate. You were actually the one who organized this event with Linda. You were really passionate about making sure that we held an event in Canada at a pharmacy about low-dose naltrexone. So how did you get involved in this, and why are you so passionate about this LDN connection?
Well, as you know, I've been doing this a long time, 40 years, and the medications that we've been using for for pain and inflammatory disorders are essentially the same: steroids, chemotherapy, and recently some of the new biologicals. But essentially, we're still very primitive in our pharmacotherapy, where we're just simply shutting down the immune system, and and yet it's beginning to emerge in the last several years, literally with thousands of studies a month, that gut chemistry is intimately involved in regulating our immune system, and in fact probably the origin of many of these autoimmune disorders. So primitive chemotherapy with lots of risks associated with them. I mean, everybody knows it. And how come we haven't made any advances? And now we're making significant advances in the microbiome, in the understanding these primitive receptors, of the opioid receptors, and the endocannabinoid system are also great targets in regulating the immune system, and are beginning the understanding literally of how our gut chemistry is the primary organ in regulating the immune system. So it's an exciting time to be able to offer what I think are root cause therapies for some of these conditions that we have very little options for, as illustrated so eloquently by Linda in her journey.
Mm-hmm. And so I guess sort of, the way, you're articulating is that there is this explosion of research and this huge understanding in the literature about what's driving inflammation and autoimmunity that just isn't translating to the clinical setting right now. And so LDN is sort of on the forefront of that, because even though we know so much, people are still going in and getting the same options for these complex conditions.
Yeah, and I mean, no question, even the microbiome, we know the microbiome has evolved. That's not a question, but we don't know there isn't like one pill to fix it. If someone has a serious digestive disorder, it may be very individual work to actually heal and repair the gut. Things like even vitamin D status, vitamin A status, certain polyphenolics help it. But meanwhile, while you're trying to sort it out, something as simple as give this LDN, it makes a difference. And to calm the immune system is an amazing tool, while work with the microbiome is evolving. You know what I mean? So it's not so simple microbiome work as it is with LDN.
Right. And so basically, the way you're using it in your practice is then sort of a bridge while you're treating underlying root of, having to treat the gut microbiome.
Well, I think we alluded to it. Sometimes it doesn't work anymore. What's it? your regular is autoimmune disorders lack of LDN in the body, right? Or it's so there it was is there a more fundamental breakdown of the immune system, which we know is in the gut. We know the regulatory, all the cells that are upregulating and downregulating and adapting our immune system are found in those important cells lining the gut. So absolutely, but it is complicated what's going on in our guts. But at the same time, LDN gives you a profoundly important tool to calm things down without risk associated with the other agents that are commonly used.
And so do you think that having a disrupted gut microbiome or disruptions in the gut could lead to exacerbations of autoimmune conditions or worsening of autoimmunity?
Well, that's been proven. You know, for example, in a parasite or a food poisoning or even an H. pylori infection is proven to trigger autoimmune disorders. Recently, there is an excellent study in kids with type 1 diabetes that showed that with an altered or disrupted microbiome made it significantly increased risk of developing full-blown type 1 diabetes, which is the autoimmune type diabetes. So, there's absolute links that what comes first is kind of the gut issues. And in my practice, it's kind of when I wrote this book, the biology of the brain, what I was saying initially was saying, well, if you have mental health issues and a gut problem, an obvious digestive problem, gas, bloating, diarrhea, constipation, irritation, why that should be considered a target in terms of improving mental health, and as well as using a variety of drugs that may have limited effectiveness. So it's just so similarly in autoimmune disorders, if you have gut problems, the gut should be considered, having a pristine digestive system is a reasonable therapeutic objective while you're using LDN.
And so do you think LDN, or I don't know if you've seen this in the literature at all, does LDN have an impact on gut microbiome or gut health?
Yes, absolutely. So it goes back and forth, right? So some of the most things that we've seen is impact on Crohn's disease or inflammatory bowel disorders. LDN has had an impact on those. So there's some decent literature on that. So absolutely, it goes back and forth, right? Gut problems increase risk of autoimmune disorders. And if your gut is inflamed and it's recycling, LDN may have a role in calming things down. But again, you want to try and improve the actual microbiome while if LDN is buying you that time. So that I think is reasonable, because you cannot improve gut health without understanding the role of fibers, probiotics, and I've become kind of a fiber geek because it's such it's a crucial thing. And 90%, actually it's about 99% of Canadians don't meet a fraction of Canada Food Guide guidelines for fiber. Yet, even often I say to my clients, the British Medical Journal just published a study analyzing over 180 observational and clinical studies over 135 million patient years, that for every 8 grams of fiber that you consume, you'll reduce your risk of dying of cancer, of colorectal cancer, dying of a heart attack and stroke, and having diabetes by up to 30% for every 8 grams. So your risk of doing this right is only, you might not die of other things as well. So
why is that for people who are like, well, because historically fiber is to keep someone regular. And so when they hear these profound statements, I think they're not understanding, what does fiber do for someone's gut?
Well,
what is it?
I actually just looked up some of the literature that's being taught to pharmacists and doctors on soluble fibers, and they're still teaching and saying that you know, soluble fiber makes this kind of mass that goes in one end and out the other, which is wrong. Soluble fiber is the superfood for the healthy, anti-inflammatory, immune regulating bacteria in your gut. So without soluble fiber, your immune system will not work optimally. You'll be deprived of these things called short chain fatty acids, which activate the immune system correctly and activate that thin one cell layer. It's just one cell layer between you and inflammatory nightmare, and it maintains the integrity of that one cell layer, which is really between the outside food and your body's immune system. So that leaking is a bit of a disaster when it comes to triggering immune responses.
And do you think this is kind of the underlying cause, you know, not specifically fiber, but this whole notion of microbiome? And I mean, I know there's other things involved, but this explosion in autoimmune complex conditions that we're seeing, especially.
We have an explosion of food allergies. We have an explosion of autoimmune disorders. We have an explosion. So, you know, when I was growing up, I never heard of a food allergy. That, you know, now it's rampant, right? There's whole schools that you can't even bring, I think, peanuts within a mile radius of a school, where I've never heard of it. So what has changed is not some, you know, our genes haven't changed in our generation, but the qualities and the effects of chemicals and sugars and all the different profound insults to our microbiome, that's changed. And one of the defenses of that is probiotics and soluble fibers.
Mm-hmm. And I think, you know, this is why, you know, we wanted to do an event like this, because we have to look at both sides. And I think that's what you're saying. We have to face the reality that there's people that have these conditions that are struggling with no answers and no options for treatment. But we also have to really push education so that we can hopefully influence prevalence and management before people get to levels where they need to look at such at different alternative therapies for management.
And that's right. As a pharmacist, you have to be profoundly aware of the limitations of therapies and the side effects associated with these things. And as we see this explosion, and again, this explosion, and I mean, clinically, especially in mental health, to see such significant improvements in terms of mental health or addiction or autoimmune disorders when you improve gut health as kind of a side effect. Sometimes I always say, what if we improved your gut health? Would that, you know, would that improve your life? Oh, yes. And what if the side effect was you had a significant improvement in your autoimmune disorder? You see, sometimes it's almost, you know, but medically, what are the tools that a pharmacist or doctor has to improve the digestive system? Practically, I know there's no drug that is not proven that's going to fix your digestive system. It really comes down to the big levers of diet, quality, you know, soluble fibers and probiotics. There's no magic in this. And the art is the application in the right order of healing, repairing. You know, the endocannabinoid system is another interesting target that's emerging as well, to kind of improve that inflammatory layer in the gut. So again, we can use different tools in the short term to calm and heal the gut as we're repairing primary microbiome. And of course, LDN is what a tool, right, to be able to calm things down and to regulate it without the risks associated with all the existing therapies we have.
Mm-hmm. And I wanted to ask you that, you know, do you think that treating the microbiome when someone, you know, it's almost feels when someone's in an autoimmune flare and someone's really struggling and they're, you know, pain from fatigue from, like Dr. Junik was saying, lifting up groceries and, burning pain in the night, keeping them up. Is treating the microbiome on its own enough to put out that wildfire? Or do you think we have to start looking at calming down that immune response in conjunction?
You're absolutely correct. When someone's in a full-blown autoimmune flare in the gut or whatever, I wish I learned it not the hard way, but trying to move too quickly by healing the microbiome can trigger more problems. So you have to be very gentle and use, and calming things down. And again, such a powerful tool to calm things down with LDN, because once someone's in an acute inflammation, it's like your leg's inflamed, and you need to do certain exercise for it to heal and to build the muscle, but it's inflamed. So if you move it, it hurts. So you have to calm things down often before you can start to even do microbiome repair. So it's a great question. It's just, this is where it becomes important to go to a practitioner that understands these things. You can't just fire soluble fiber into someone who's in an inflammatory state. It can make it worse, but once they're calm and you're healing, it's essential to maintain.
And I think exactly. And I think that's kind of looking at, this is the art of practicing medicine, is understanding when to implement certain things, when to back off, and start to understand, even the feedback we've gotten from certain patients where the only tool they're relying on is LDN. And so understanding, in the scope of immunity and flares, if we're not utilizing other targets, then we're only relying on one thing ultimately to control what's going on. And if we know the root of inflammation is through the gut, it does become essential in a lot of these treatments of other conditions.
Yeah, and you're absolutely right. So, how often but we deal with that as well, in our practice, and with CBD or LDN, sometimes they're so effective that people say, oh, it's fixed. And I'm going, well, no, you didn't get into this inflammatory state because of, not using enough LDN or CBD. There is an underlying inflammatory response going on that should, and if you have if you have insufficient fiber, for example, why wouldn't you take advantage of this time to start to repair structures that are proven, particularly polyphenolic fibers, proven to repair the the immune system. Things like, this is your time to repair your vitamin D status, your vitamin A status, your nutrients that are proven to be important for regulating the immune response and your microbiome.
So we had a really interesting question here, and I think you'd be really good to answer this. Why should I choose LDN over corticosteroids?
Well, the corticosteroids are non-specifically shutting down your immune response. And the price of that is all kinds of things, right? You have, especially long-term use, you have issues with disruption of the gut, right? These are horrible to your gut. Higher rates of bone loss, diabetes, weight gain, serious metabolic problems. I mean, the list is just virtually every organ can have adverse effects from corticosteroids in the long term. So there's nothing wrong with a short burst of steroids in an acute inflammatory response, probably the safest thing to do. But when you're in a chronic basis, then you are starting to have always chronic adverse effects. And again, going to my point, your autoimmune condition is not a lack of steroid in your body. It's literally, the purpose of it is to non-specifically shut down the immune response, which has its own problems as well.
Yeah, exactly. And I think for a lot of conditions that LDN is being used for, and this is what Dr. Junik was alluding to as well, is that, you don't always see rampant inflammation. So people don't necessarily respond really well to corticosteroids if they're not modulating that low grade immune response that's triggering sensitization within their central nervous system. So understanding what it is that you're trying to do rather than blasting someone's system.
Well, yeah, and pain. I mean, in terms of dealing with pain for many years, the whole concept of central pain versus nociceptive pain, meaning the receptor pain, we're beginning to understand, thankfully, that you can't just fire drugs into someone and without understanding the relationship of how the brain perceives pain and can be inflamed versus, it's like, versus the receptor, meaning it's very different if I step on your hand and you feel the pain there, but what if but your perception of pain can be dramatically altered depending on the sensitivity of your brain.
Mm-hmm. And that's where kind of that beautiful, I think, where LDN and gut microbiome work really well together, because you're almost depleting the gasoline in the tank that's setting the fire. And so LDN is calming down the flames, but you do need to kind of remove some of the gas that is leading to that huge flame in their system.
You have to help people. I mean, again, I wish we're not there yet. I mean, we will evolve to a point where we will have more precision in reducing autoimmune disorders through gut chemistry. But it is probably unlikely that there'll be patented fibers or patented probiotics or patented diets, because it really is public domain, right? So, and similar with LDN, it's just it's an excellent tool to be able to calm things down while you're improving your overall gut microbiome. And like I brought up the example of fiber, the side effects are, oh, by the way, there's probably nothing more proven to reduce your risk of actually dying of cancer and heart disease, the top two killers, as soluble fiber. It's actually embarrassing, the fact that you're talking about something that is so profoundly true, and it improves your immune system.
And
not well described, right? Why are we having to talk about this all the time when it's just proven? Well, we're looking for that pharmaceutical answer, right? So LDN gives us a safe tool while we're trying to educate and talk about some of these more profound systemic issues that are affecting your immune system.
And I guess the discussion always is it, is it just the lack of fiber in someone's diet, or is it the lack of fiber due to the processed and inflammatory diet that someone has that is devoid of any sorts of fiber at all? And so
exactly. I mean, when you start looking at the big lever of food, I mean, people say, I have a good diet. And then you're going, oh okay, well, you don't have 10 or 15 grams of fiber in your diet. Therefore, and the Canada Food Guide says 35 grams for a male and 25 grams for a female, and you got 10 grams a day. By definition, it's not a good diet, right? If it's missing magnesium, for some reason, we come up with the notion of what a good diet is, but we actually don't analyze it for the things that are proven to be essential, to be the most profound in the impact of diet. I think that's kind of nor is anyone ever asked, so many times I'll have a client say, or a patient say, oh, my doctor says I have a good diet. Well, first of all, they haven't asked them what they eat, or they haven't analyzed the fiber content.
Mm-hmm.
Most people
and you
don't.
brought up, certainly. And I brought up you've brought up a couple times polyphenolics. Can you explain to people who are listening, what is a polyphenolic? Why is it beneficial for gut? Why have we brought it up today?
So polyphenolics are things like quercetin, curcumin, naranjin, hesperidin. These are kind of like the white parts of oranges and are these fibrous parts of resveratrol is another polyphenolic, grapeseed extract, all these green teas, all these parts of plants that have, and herbs that have suggested and shown have these significant health benefits. But what they do in the gut is that they grow very specific structures in the gut that, for example, polyphenolics improve akkermansia, they improve Clostridia cluster 9. So these are really involved in that protective mucus coating of that single cell layer in the gut. Polyphenolics improve the quality of your bile. So actually your own body will make healthier bile that will kill fungi and more pathogens. So with polyphenolics, you actually make a healthier bile that is more, that makes your body its own antibiotic, antibacterial for cleaning up unhealthy bugs. So it's fascinating how many roles of different fibers are to keep your body healthy without us adding more chemicals. So it's quite, and polyphenolics in an acute inflamed person will generally reduce inflammation in the gut. So it's kind of with very low risk of throwing things off. So it's kind of one of the first things we use for calming the gut down or calming the immune system down.
Yeah, I think that's really interesting. All of the things you mentioned, quercetin, turmeric, resveratrol, these are all classic antioxidants and anti-inflammatories that we would typically use in every autoimmune inflammatory condition that we see, in terms of an alternative.
And you're right. I always thought they were antioxidants, and they do have antioxidant properties, but they have profound impact on the gut and bile and liver. See, that may be the actual, in fact, as even drugs that we thought, for example, like metformin we're using, that's been used for 40 years for diabetes, probably was still one of the best drugs. We didn't really understand what it's doing. It actually has a favorable impact on inflammatory, blood sugar disruptive bacteria in the gut. So again, things are starting to evolve to a point where you're starting to understand, okay, maybe what we think we're doing isn't what we're doing with drugs or medications, and there's good examples and bad examples of that as well.
Mm-hmm. Thank you so much. And I think the take home message here is that if we're talking, we can't do a whole afternoon conversation on LDN without talking about the gut, because it is that critical for inflammation and autoimmunity. And you have a whole book written on it, Biology of the Brain. It is on the NutriChem website. It really goes into detail on the connection between inflammation, gut microbiome, how different polyphenolics and fibers can influence your gut, the connection between hormones, the connection between inflammation. So it's really, really kind of gets into this conversation a lot more in depth. So I encourage anyone who's struggling with autoimmunity, inflammation, chronic pain, all these sorts of conditions that we're talking about with LDN, this is relevant. Always, 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 it's going to be relevant to talk about digestion and gut health. So thank you very much. That was a great conversation. And I don't think we have any more questions. So yeah, thanks a lot.